Hear Me Out podcast. I am your host, Dr. Jackie Jewett. Today we're going to be talking about one of my favorite topics, the babies. And so with that, we're just going to walk through a little bit on how we test newborns, when a hearing test is warranted for a baby that's a little bit more extensive than the newborn hearing screenings. We're going to touch on newborn hearing screenings and all the good things that come with our babies. And then we're going to end out just talking about maybe a case or two that I've seen and how I've had to tell the family that, you know, their child has a hearing loss and how we navigate that, diving into how we test the babies when they're born, newborn hearing screenings, and all of those things, okay? Babies, they should be screened by 1 month of age, because at that point we can kind of start to figure out, okay, is this something that we don't necessarily need to worry about, or is this something that we need to do a little bit more investigating before they get too old and they're in this critical age period of developing language? And so newborn hearing screenings are something that have been implemented across the United States, and something that is very helpful when it comes to picking out those kids that we need to do a little bit more further testing for them, okay? A couple ways that we do newborn hearing screenings for infants and those that are fresh out the womb, okay? And so one of the things that we kind of consider is their birth history. Are there any risk factors may lead to them developing hearing loss? Are there any syndromes, anything that can kind of point us to just wanting to watch this baby a little bit closer? Or are they, you know, healthy baby, just here to live life? So we kind of make those decisions first. And so in the hospital, if a baby is born in the hospital, they will typically have one of two things that they do for the screener. And again, a screener, it just simply says, yes, they can hear, or they're hearing at an adequate level in both ears, or we need to do some more testing, let's refer out or try this again in another day or two to see if they'll pass. If they don't pass, then we definitely want to push them on to go for more diagnostic testing, okay? And so with that, hearing screenings can be done in the hospital, typically by a nurse, someone that may not necessarily be the doctor, but there's somebody that's designated to do the hearing screenings in the hospital, as well as in the NICU, or the neonatal intensive care unit. And so with our well babies, those are the babies that don't really have any risk factors. They're not put in the NICU, they're not premature, anything like that. Those are our well babies, okay? So they will be screened with either what we call an automated auditory brainstem response testing. So it's similar to the more diagnostic test, but this one is just a screener. So it's running through different pitches and figuring out if they're passing at all of the pitches that we're looking for, okay? So an AAVR, that's one of them. Or we have the OAEs, or otoacoustic emissions. Now it just depends on the type of hospital setting and what equipment they have, but both of them can give you an idea of how that auditory pathway is working, okay? Babies that are no risk factors and they don't really have the family history of hearing loss, nothing is really pointing to suggest that there may be a hearing loss, may be screened with that OAE, or otoacoustic emissions testing, okay? So we use that as a way to give us an idea if the baby would need further diagnostic testing, okay? And now the other one, the automated auditory brainstem response testing, again, it's quick, it gives us an idea, and they test both ears to make sure that the baby is passing. Now, if there is any indication or any suggestion that the baby may not be passing, or they may fail, personally, I don't like using the word fail, but we are trying to move, from what I've been told, we're trying to move towards saying pass or fail, because when you say referred, or they didn't quite pass, it doesn't sometimes put enough emphasis or seriousness in the parent's understanding that we definitely want to make sure that there's nothing here that will delay their speech and language down the line, as they're getting older, because again, there's a critical window that speech and language is developed in from birth to 3 years old. Is a very critical time in a human's life to where language is being processed and learned and all of those things. And so having a hearing loss at a young age during that critical period, if it is an undiagnosed hearing loss where other modes of communication have not been already introduced, not knowing that a child has a hearing loss, whether that is a slight hearing loss or a profound hearing loss, not knowing that during that critical period of time can be very detrimental to your child's speech and language development. And so that is why the newborn hearing screening is very, very important to get done, because if there is something that can be identified at an early age, then we can kind of start talking about the different steps of how do we want to proceed, how do the parents want to proceed with language development, communication, and things like that. Okay, and so that is one of the biggest things, in my opinion, is that, you know, if a baby is maybe born at home or in a birthing center or something like that, we want to make sure that they are getting in to see someone to get that screening done, so that we will know if there's any intervention that we need to start right away. Okay, now let's have a hypothetical scenario that, you know, baby is born and the screener comes in, they do the screening on both ears and it's failing in both ears. Okay, the test is coming back as a fail, both ears. Sometimes they will give it a little bit of time before discharge from the hospital and try it again, because, well, you know, keep in mind, a baby is submerged in fluid for 9 months and then they're born. Some of that fluid can still be in the ear canal and causing the test to not run correctly. Okay, because remember, we have to put the sound into the ear to see how it goes up to the brain, or that's the more AABR style of a test, or if we're looking to put the sound into the ear with the otoacoustic emissions, we're looking for a sound to come back out. So if there's any obstruction in the ear canal, anything as far as fluid, debris, anything from birth that could still be in there, could affect that screener. So we have to keep that in mind. Okay, so if they do it at the hospital and prior to discharge or prior to you going home, your baby has failed the hearing screening, that is when we're going to look at getting you referred to do more diagnostic testing. Okay, so with diagnostics, that's going to be something that is going to tell us, okay, at this sound or this frequency or this pitch, this is the softest level that your baby is hearing at. And so we have norms, we have different data that has been studied, and it will tell us that if we can see the waves, or when we're doing this test, we can see those down to a very soft level within that researched range for your child's age, then we can say yes, that they should have normal hearing and they should be able to do just fine. Sometimes that is scheduled maybe a month after the baby is born, so they come and see the audiologist by the time they're maybe a month and a half old. And so we're doing this more diagnostic testing to be able to see again at what levels they're hearing at. By that time, all of the birth fluid and things of that nature should be gone, and so it gives us a clear understanding of how the baby is hearing. Okay, and so we do some other things to kind of piece together everything. So just specifically where I have done my training at, we had a protocol where we would, you know, bring the baby in, do some case history to make sure that we don't see anything that sticks out that may be an indication that hearing loss may be present, or hearing loss may run in the family and things of that nature. So risk factors, we're wanting to ask those questions at the beginning. And then we get to a point where we want to check, look in the ear, make sure there's nothing in there, because again, we have to put earbuds in there. So if there's debris and things of that nature that's in there, it could affect the testing and the results that we get. So we make sure that that is going to be done. We do a test called tympanometry. So what we're looking at is to see how the eardrum is moving. Is it moving like it's supposed to, telling us that the middle ear space is clear, no fluid or anything of that nature that would be kind of impeding or making sure that there's nothing there that could also then again affect the testing. And so we do that, and then again, where I was trained at, we would start with otoacoustic emissions. That is just again another screener or an overview of how sound, how the child is hearing. We can get more in depth about what it actually tests, but just for the purpose of today's video, we do that testing to get a general idea of, are we getting robust responses back from the ear when we're putting the sounds in, or are those looking a little iffy, like we might truly have a hearing loss that we find, okay? So then the diagnostic part, the true understanding of where the hearing is at, comes in after that. And so the auditory brainstem response test is something that we do on babies, and we can do it sedated or unsedated, meaning intentionally put to sleep with medication, or unsedated, where most of the time that's what we do on the little babies, because they sleep so well. If you feed them right before, they'll fall asleep. So we'll do that. We'll scrub them, prep their skin. So we use a little soft exfoliant to make sure we can get good readings on their head and then behind their ears. And that's just going to help us to read when we put the sounds in their ear, how is it traveling to the brain? Okay, so that will tell us, was the newborn hearing screening that was completed giving us more of an idea that there might have been fluid after birth and that's why they failed in both ears, or did that newborn hearing screening send this baby to the right person so that we could know that they have a profound hearing loss in both ears? Not to say that that's what happens all the time, but it does happen. And so we need the newborn hearing screening to be in place and to be there to be able to get those children when they're born and we first see something that is not what we would expect, to go and then follow up with the proper professionals to make sure that they get all the resources that they need to grow up and be a successful person, okay? So some of the things, and I guess I've mentioned before that we have some indications or something that a parent may tell us that may warrant us wanting to dig a little deeper, because there are some things that can correlate with hearing loss, okay? So if the child has an extensive family history of hearing loss on dad's side, grandma was born with the hearing loss, and then 3 uncles were born with the hearing loss, and then dad also has a hearing loss, that is a indication for us that, okay, we need to monitor this child. We want to make sure that they are followed closely, because if this is something that's genetic, hearing loss can be genetic, then that's something that we want to make sure that at no point do they just lose the access to the sound if that is how they were starting to learn to communicate, okay? Because that can be very detrimental to a child's development if they were learning, spoken language and learning how to communicate in that way, and then all of a sudden they can no longer hear as well, and so they can no longer develop at the rate that they were going when they didn't have the hearing loss present. So those are some things that we think about. So family history, if the child spent any time in the neonatal intensive care unit or the NICU, that is also something that we want to know, because those things that happen in there can also be contributing factors to hearing loss coming later in life, okay? So if it's low birth weight, so premature babies, they are, that's a risk factor. If they were born with any type of drugs in their system, that could be something that we want to look at. If they received any IV antibiotics for any infections or anything that they had at birth, that's something that can cause a hearing, potential hearing loss later in life. Any mechanical ventilation, so if they were intubated at birth and they were breathing off of a machine, those are the things that we look for when we want to make sure that we follow the baby a little bit longer, okay? So back to our scenario, we're here, we've tested the baby, ears are clear, We did OAEs, DPOAEs, look beautiful. We get to the point of doing the testing. We are seeing beautiful waves down to a normal level. Good, okay? That's what we want to see. But let's throw in a little bit of a curveball, right? And we knew from case history that dad has hearing loss and that baby spent 2 months in the NICU, right? So baby spent 2 months in the NICU. We did this testing. Hearing is looking good. We're not seeing anything that looks abnormal. But because of that history, that's something that we're going to want to monitor this baby until they can give us behavioral responses, or they can tell us what they're hearing in both ears. Okay, then we can discharge them and follow them as needed. But until we get that, that's something that you want to make sure that you follow the child, because again, you don't want something to come up at a point in their life where they're learning critical information to be a successful adult. Okay, so with that, we get beautiful things on the testing, and we're not really seeing anything at this time that would indicate they're failing. But again, our scenario, dad has hearing loss and the baby failed twice prior to leaving the hospital, so they came for the diagnostic testing. Okay, we are seeing that the child is performing normally from our testing, that we don't see anything that is indicating hearing loss at this time. But given that history, that baby failed twice in the hospital and dad has a family history of hearing loss, we want to monitor that child a little bit closer. So if the child spent some time in the NICU, say 2 months, we want to make sure that they are developmentally at the age where we can test them behaviorally. And so with that, we wait about 6 months from when we do the first testing, so they would be about 7 months old. But again, spending some time in the NICU, we may push it out till they're about 8 months old, because corrected age, they would be about 6 months old. So we can push it out a little bit. Sometimes babies will, not have any effects, and they will be developmentally where they're supposed to be, not counting their time in the NICU. But just to be on the safe side, we would do about 8 or 9 months old actual age, and then correct it back to 6 to 7 months old. Then we would test them behaviorally in that setting. I think I've talked about it in a previous video before, but in that visual reinforcement setting. So they're sitting on mom or dad's lap, and we are having them look for the sounds in the sound field. Now we can do that under inserts if we did suspect the child had a hearing loss at that age. But if everything is looking normal, when they come back for their follow-up appointment at that age, we'll kind of try it just in the sound field, just to get what we can get, and then adding in some other testing just to keep making sure that each ear individually is working like it's supposed to. And then we follow them again until they're able to give us the responses back in both ears, that we can kind of check off that we're not really seeing anything, and we can kind of monitor them as needed or annually if there's that family history. Okay, so now in the case that a baby does have a hearing loss, it's something that I personally had a hard time at first being able to tell families or tell parents that your child has a hearing loss and we need to figure out a plan for them. That was really hard for me to say, because it's like, I don't know if I just was nervous to tell them what I was finding, or maybe wasn't confident in what I was finding. But as I got more confident and more advanced in my education and my schooling, it came kind of natural to me, because I was like, you need to know this. Like, I'm just tell it to you. We can cry together. You can cry. I'll get you some tissues, but like, you need to know this. And so that's something that I think that it may be hard for some people to do, and maybe that's why they stray away from the younger kids and doing testing with them. But as a pediatric audiologist, or someone that works with the pediatric population, that's something that you're going to have to kind of think about and make sure that you're ready for those conversations, because they're not easy. I don't know that they will ever be easy, but you'll get to a point where you're like, we just got to talk about it, because we need to start thinking about the next steps. Okay, so there's very much an emotional trigger that happens with families. Some people will react they will react how you would expect them to react, but some of them may not react how you expect them to react. And so I've had families who I have had to tell that their newborn has a hearing loss, both ears, and we need to start thinking about different options for them. Now, this baby was the degree of their hearing loss, they were able to be fit with traditional hearing aids. And so we kind of went down that process because the family chose that they wanted the child to be able to develop spoken language. They weren't really interested in the route as far as like using sign language and things of that nature. And hearing loss does vary. So hearing loss doesn't necessarily mean that you can't hear anything. That can be the case for some people, but some, it may be that they can hear like low bass tones fine, but when it comes up to like the higher pitches, that's where their hearing loss is. And so they struggle to have more clarity or understanding of what the words are. They may know that somebody is talking, but having the clarity of what they're saying may be where their hearing loss is impacted. So that's a lot of the things that we have to kind of walk through with families, is talking with them about, you know, what does this hearing loss look like? What does this mean for their child? What does this, you know, what does this show them on this graph that we, you know, can kind of draft up for them to give them an idea of where their child is hearing. So that's something that we have to kind of make sure that we're ready to discuss that, because there's going to be those questions. If you are a student and maybe getting ready to go into your pediatric rotation, that there's going to be those questions. If you have a child that you diagnose with hearing loss, you're going to have to, obviously with your professors there too, but even if you're a new professional too, there's going to be those questions of like, so what does this mean? And what does this mean? They're asking you to pretty much try to, you know, tell them what to do next. And that's going to be something that you have to have the resources, the understanding, and know that there are different things out there, different options, and we can walk through them all. So having that emotional intelligence is something that will definitely make or break the situation, in my opinion, because if you don't have the emotional intelligence, or you don't have the ability to let them know kind of what the resources are and what the next steps are, it's going to be really hard to kind of build that rapport with them and make sure that they feel that you have their child's best interest at heart. So understanding that there are resources out there for children, there's reading resources, and hopefully soon I will have some resources to send out as well. But I want, you know, new professionals, I want people that are looking to join the profession, and then also families, if you're watching this, I want you to know that there are resources out there. There are people that are trained and that want to help you through the situation. And so just knowing that hearing loss is not the end of the world. It is not going to make your child any different than anybody else. And I really hope that it comes across that, you know, hearing loss, yes, is and can be labeled as a disability, but it shouldn't stop their success. Your child can still be very successful. I know people that have hearing loss that are very successful with and without amplification. And so I think that it really goes back to the resources being provided to families, and then families taking the initiative to make sure that their child gets the services and the resources that are awarded to them or given to them or provided for them, so that they can excel with no issues. Okay, with that, I kind of just want to wrap it up with, you know, I have had I have been tasked with telling families that their child has a hearing loss. I remember one specific case that the child was older, but there was a significant family history of hearing loss, and she had not passed she had failed a school screening, and so they sent her to us to have a hearing test done again, and lo and behold, she had a hearing loss. And the type of hearing loss that I got on her was what we call a cookie bite, and those are very much indications of genetic hearing losses. And so with mom having hearing loss, then me finding her with a hearing loss, you know, it was like, yeah, mom, like she has the hearing loss. Like the school wasn't just, you know, just sending her here just to send her here. And so that was one that I didn't expect it to I knew that it was going to be upsetting, but I didn't think it was going to upset mom to the point that it did, just because mom had told me that she had hearing loss. And so I just thought if I told her that, you know, her daughter has hearing loss, that it may have been something that didn't come as a shock. But after we talked about it, it made a lot of sense of what mom was saying and why she felt the way that she felt, was, you know, because she knew what she had to go through. She knew what she had to, you know, endure growing up and not having, you know, hearing aids or whatever when she was younger. And so knowing that her daughter now has hearing loss, or has had this hearing loss for who knows how long, it was something that she kind of reflected on herself of what she went through. And so I just want to say and encourage those that are working in this setting that it may be hard to be an empath or, you know, be empathetic with people, but I would just encourage you to try to practice it. It's never easy telling someone that, but I think the biggest thing at the end of the day is just making sure that you listen to the family. This is not a time for you to just start spewing more information at them. You say what you have to say and then you just wait. You know, that's something that I've learned and seen other of my preceptors show me. They say what they have to say and then they just wait, because at some point the family is gonna want to start talking and, you know, asking questions. And so allowing them that space to do so is, in my opinion, one of the best things you can do. When you allow families the space to talk with you and to make sure that they understand as much as they can in that moment, I think that's one of the best things to do. Again, it's going to be hard. It's going to be tough. It's okay to cry with them, because in my opinion, I feel like it shows them that you care for them, you care for their child, and you want to make sure that you give them as many resources as they can find to be able to make the best decisions for their child. So it's tough, but I think that at the end of it all, it's very rewarding to see how the child develops and becomes who they are as a person, regardless of their hearing status. Okay, so again, just want to recap that newborn hearing screenings are very, very important. If you are someone that just had a child or is about to have a child, first, just make sure that hearing screening is completed within their first month of life. And if it's something that warrants them having a more diagnostic testing completed, I would really, really encourage you to make sure that you follow up with that, because the sooner that we can identify there's a hearing loss, the sooner we can start any interventions that the family feels is appropriate and necessary for their child. And then we can also offer different resources to keep the child developing as they should with their speech and language, okay? And then, so if you're following up, definitely want to do that. Now, if you are someone that then follows up and gets the information that your child has a hearing loss and you don't know what to do, and, you know, it seems hard, I would just say definitely trust the person that you're with. We don't get into audiology just for the money. I can tell you that much. And just know that the person that is with you, they want to make sure that your child is going to succeed and going to have the resources that they need. So ask all the questions that you can think of in the moment. If you feel the need to cry. If you feel the need to, just get to work. Just know that your audiologist is going to be there to make sure that you know the resources and you can get them for your child. And then just make sure that you take the steps and are proactive at doing those things that are recommended, okay? So that is all. I encourage you to share this with anyone that you know that may have a child who is diagnosed with a hearing loss. If you have anyone that is, not sure if the speech and language development of their child is appropriate. Definitely getting a hearing test doesn't hurt, because again, during that first 3 years of life is when language is developed and learned and all of those things. It's a very critical time period. And so if you know anyone that you feel needs some encouragement, hopefully I can, be that person to encourage them that, again, hearing loss is not something that is going to make or break your child. It's something that is different about them, but again, it's something that they are going to be successful no matter what. So if you give them the resources and put them through the things that they need to be put through, they're going to do just fine. And I have seen it. And I can attest to it. It is not something that is going to hinder their development, okay? As long as they get the resources that they need. So this was a very, very fulfilling episode to do, because again, I love working with babies. I love working with families. I love educating people on what it is that they don't know. So I just hope that this can reach some people that maybe are on the fence of, what do we do? Or, this is someone that's on the fence of, should I try peds? Should I try pediatric audiology? Yes, you should. It's phenomenal. But I just hope that this touches the right people, and that we just keep on keeping on. But that is all, folks. Hear me out, because we got a lot to talk about.